And welcome back. As you saw a few moments ago, that the Ituba National Lottery was donating protective equipment to the Health Minister, Dr. Zweli Mkhize, which has been a major issue on the frontier to at least flatten the curve and reduce the number of infections from COVID-19. It's a worldwide problem, as we mentioned earlier on, as the country announces that the number of positive cases has increased, as you can see on your screen there, risen to 8,232, and the death toll now standing at 161. Now, to look at the conjoined effort by countries around the globe, we're joined now by United States Ambassador to South Africa, Lana Marks, on details for various U.S. efforts to help South Africa fight COVID-19, and we'll be talking about other issues as well. Ambassador, thank you so much for joining us. As you just saw the handover of personal protective equipment being handed over to the Health Minister, I believe that as the U.S., you also have your own announcement to make in terms of aid to South Africa.
Yes, indeed, and thank you so much for having me on the show tonight. I am very pleased to announce that the United States will be donating to South Africa a substantial quantity of state-of-the-art ventilators in the value of 500 million rands, $27 million, with all the ancillary equipment necessary that will be able to be used at all the intensive care units throughout South Africa. Obviously, this means that the United States has taken care of all the ventilators it needed for its own country, for our own country. And President Trump has made this possible together with the American people because they care so much about South Africa and Africa. And I spoke to the CEO of this ventilator company last night, and this is only the second country in the world that these ventilators are being donated to and sent. And the first shipment is very imminent and will arrive next week.
It's very interesting that you say that, Ambassador. I'm glad you highlighted, because just looking at earlier reports in the United States, including in the Washington Post today, there seemed to be a difference of opinion or facts around the need for ventilators in the United States.
Well, ventilators are necessary because they provide oxygen and they provide oxygen to people having difficulty breathing. And so this assists very, very ill people with COVID-19.
Mm-hmm. And just in terms of protective equipment, nurses in the United States were also saying that seems to be a problem, that there's a shortage thereof, but President Trump also rebuffing this. Is the United States saying that it has adequate PPE for people at the front line?
And there is adequate equipment for PPE for people on the front line. Obviously, each state has spoken to President Trump and FEMA, and it is judged on a state-by-state basis. And by all accounts, yes, indeed, they do. There is now an excess of equipment because all the manufacturing of the United States was put into overdrive.
Okay, so let's talk about the relationship with South Africa, the current assistance by the announcement that you've just made of ventilators. That stands at 410 million rand, $21.5 million. Tell us how that is going to be invested. Are there directives on where the money should go, and are there any conditionalities as well?
It's actually the equipment that's going to be shipped in to South Africa. So the actual ventilators and all the equipment, state-of-the-art, are going to be shipped into South Africa and then shipped to all the intensive care units around the country. Okay,
so then there is a figure of 250 million rand that's also been mentioned by the U.S. government to help combat COVID-19. Where is this? So we talked about protective masks. I believe that also is going to be part of what you're donating. Let's talk about PEPFAR, which is a partnership that you've long had with the South African government. And obviously there is the issue of people with comorbidities who are most vulnerable. How is it going to change how you donate funding, aid, and what the priorities should be?
This is in addition to all the other funding donated by the United States. The PEPFAR is a 17-year-old program in which the CDC and USAID jointly are involved to save lives of people with HIV, and we're hoping within the next year to get to epidemic control. This is a $9.4 billion program invested in South Africa over 17 years. Because we have such a significant infrastructure for this, together with the South African Ministry of Health, we are able to use this infrastructure to assist with COVID-19. So the funds recently, in the last few weeks, donated in terms of COVID-19 to South Africa are for all kinds of technical equipment, aid in terms of training for all the facilities around the country, 5,400 healthcare workers, salaries of many, many folks in, and also for the labs and many, many other things that are going in South Africa together with the Ministry of Health.
Now let's talk country to country experience. You are obviously at the summit, one would perhaps describe it as, in terms of the death toll due to COVID-19, even though there is a back and forth with health experts on just what your model is in the United States. What have you learned that you feel that you could share with South Africa, given the fact that we are easing our lockdown regulations in order to get the economy going, but we also want to make sure that we don't exacerbate the number of positive cases?
I think the fact that South Africa has seen what has gone on in other countries, notwithstanding the United States, Italy, the UK, they've seen how to handle this. And I commend President Ramaphosa and Minister Mkhize for being strict and taking strong and firm statesman-like action in South Africa, which under the circumstances is absolutely necessary. And people need to support the leadership here strongly, because they're doing everything they can to protect South Africa, taking into consideration what they've seen go on in other countries.
Treatments, this is something that's also been very much at the forefront of international discussion. The issue of remdesivir has been very high on debate as well, on whether or not it is effective in preventing deaths. The United States recently approving this for treatment. The question has been why, if it's not part of the core treatment, because while it disturbs the genome pattern, it doesn't necessarily mean that it prevents deaths.
Yes, I spoke to the CEO of Gilead yesterday, and we discussed this, and it reduces stay in hospital, and it seems to assist in the process. It's not a vaccine, and it's not being portrayed as a vaccine, but it is being helpful at this time.
So are you saying that perhaps you would encourage other countries to do the same in terms of the experience that you've had, the numbers that it's been tested on?
It seems to have very positive results. And yes, I would encourage other countries to keep stocks of this. And they are increasing their production tremendously at this time, as well as doing testing very, very quickly with this.
Thank you so much for speaking to us. United States Ambassador to South Africa, Lana Marks, making an announcement there that the U.S. is donating hundreds of millions of rands worth of equipment to South Africa in the fight against Thank you so much, Ambassador. The fight against COVID-19, ventilators, state-of-the-art, saying that South Africa is going to be one of the first countries to receive this. The second, I think she said, and we will keep monitoring that story, and you can learn about it more when we look deeper into it, what this means for our fight against COVID-19.